Hello and welcome everyone. I'm Dr. Sachin Kotasthane from Lotus Medics. Welcome to yet another educational information video on a very common topic, but one that's really important. A pap smear. What is a pap smear? A pap smear is part of the cervical screening test. Who is eligible? Well, any woman between the ages of 25 to 74 years who has a cervix and who has either been sexually active before or is currently sexually active. Now, what are the different types of pap smears? Let's have a quick look at those. You might have heard of something called as a self-collected smear. Well, this is when a woman goes to a pathology lab or a GP practice, is given a pap smear, self-collects it by herself and deposits it for analysis. The other common type of pap smear is one that is collected by your health practitioner, your GP or a specialist or a nurse at your healthcare professional practice. During these pap smears, often patients are made comfortable, either lying down in a dorsal normal lying down position or with their legs in stirrups. With the help of an instrument called a speculum, which is shaped like a duckbill, the vagina and the cervix are exposed. With the help of a thin brush, cells are collected from the outside and the inside of the cervix. These are then analyzed for the presence of a virus called the human papillomavirus. We also look for any abnormal cells which might be exfoliated or shed during this process to see if there are any abnormal changes within these cells. What does an abnormal pap smear mean? What are the implications of an abnormal pap smear? So let us look at the different strains of the human papillomavirus. The HPV virus or the human papillomavirus has multiple strains. The two main high-risk variety of strains, also called the high-risk HPV, are the strains of HPV 16 and HPV 18. All the other strains are categorized or relegated in the category of low-risk HPV because they are not high-risk HPV, i.e. they are not 16 or 18, so they are called as non-16-18 HPV. So either your smear might be negative or normal, which means you don't have any HPV virus DNA detected in your smear, and of course there are no abnormal cells which have been detected on your pap smear. This is great news because this means that we don't need to see you for another 5 years for another pap smear, which is part of the regular cervical screening process. Sometimes the smears are reported as unsatisfactory. Now, what does that mean? Well, it means that even though we may not have seen any HPV virus strains, we may also not have adequate cells which are collected, which means we can neither tell if you have any abnormal or normal cells present on your smear. The implications of that is you may need to present to your GP or your healthcare professional again within 6 to 12 months for another repeat smear. A common cause for these unsatisfactory smears are due to lack of estrogen, which means that the cells of the inside of the cervix may have migrated further inside and may not have been collected by the pap smear. Sometimes you may have a cervical screening result, which means you have to return to screen. This means that you may either have had one of the low-risk HPVs or you may have what's called as a low-grade lesion of the cervix. So the lesions of the cervical cells are again classified as high-grade and low-grade lesions. Low-grade lesions are those which can sometimes disappear. Hence, if you have either a low-grade lesion or a non-16/18 HPV, you may be called back again within 6 to 12 months for a repeat HPV test. The third type of result is that of an abnormal HPV result or an abnormal smear. What this means is that you may have either had a high-risk HPV, either HPV 16 or 18, or you might have had a high-grade lesion on your cervical smear. Also, you might have had persistence of either a non-16/18 HPV or a low-grade lesion on your smear from 12 months ago. In any of these three situations, you may be invited or referred to a gynecologist to have what's called as a colposcopy. Now let us understand what is a colposcopy. A colposcopy literally comes from the Greek word kolpos, which means a vagina, and skopos, which means to look at under a microscope. So colposcopy essentially means looking in detail at the cervix and vagina through a magnified lens, also called a colposcope. This is a procedure wherein the cervix is stained with a couple of solutions. One is the acetic acid and other is iodine. A very detailed, careful and comprehensive look to look for any abnormal areas, any precancerous cells or any suspicious areas is done during this procedure. You will have this procedure explained by a gynecologist. This is usually a day case procedure. A consent is obtained during this procedure and you will be explained what to expect. Under aseptic precautions, your cervix will be examined just like you've had with the pap smear, but this time you will be in a gynecologist chair with your legs most likely in stirrups. When the cervix is examined, it is also stained, as I said, with a couple of solutions. One is acetic acid and the other is iodine. With a colposcope, which is a magnified microscope, we look for any abnormal or suspicious areas around the cervix. If we see any of these areas, we will show them to you. Also, at the same time, we will put some local anesthetic and with your consent obtain a couple of biopsies from these suspicious or abnormal areas. These cervical biopsies are then sent off for examination to see if you have any cervical precancer. There are some instances where we may not find any abnormal area, and this is of course good news because in these situations we will not need to do a cervical biopsy. Usually this procedure takes about 15 to 20 minutes and you will be able to go home at the end of the procedure. You might have some light spotting or brownish discharge and some light crampy feeling, but this will usually go away and will only require some mild painkillers like paracetamol and Nurofen. It's recommended that you avoid insertion of any tampons or avoid sexual intercourse for at least 48 hours after this procedure and preferably until the bleeding settles. Now let's look at the colposcopy results. What do the different colposcopy results mean? Your gynecologist, after having taken the colposcopy, will call you back with the results. They may bring you for a face-to-face appointment to discuss these in further detail. So what are the potential possibilities that can arise as from the cervical biopsies or from the colposcopies that have been undertaken? So either everything might be normal, that is, there is no abnormal pathology found, and which is of course good news, and in these circumstances the best thing to happen is that you may need to possibly have another pap smear in 6 to 12 months if you've had an HPV virus still persistent. Sometimes the changes on the cervical area are caused due to inflammation. And again, this is a good result because it means that there is no cervical precancer. In these situations, the gynecologist might advise that you have another repeat smear in a few months again. Sometimes we might see the presence of either low-grade or high-grade lesions. The low-grade lesions are called CIN1. Another possible report is the presence of CIN or squamous intraepithelial lesion. These lesions are of two types, either the low-grade changes or the high-grade changes. The low-grade change or LSIL is also called CIN1. This is the lower grade change and very often does not need treatment. These type of changes can revert back to normal and the body immunity can mean that you don't need to have any treatments and these changes can be overcome by the body's immune system. The other type of changes are called as high-grade changes or what were previously called as CIN2 or CIN3. These are the more advanced form of cervical precancer and certainly do warrant treatment. The third type of changes are the cervical glandular intraepithelial neoplasia or what is called as CGIN. They are caused due to changes from the endocervical cells or the cells in the inner part of the cervix. If these changes are detected on either the smear or the biopsy, then we may need to perform further tests, either in the form of a hysteroscopy, which is looking inside the womb with a telescope, to rule out any other endometrial or endocervical pathology, and may certainly need further investigation and liaising with the gynae-oncology doctors to see if there are further treatments required. So what are the potential treatments that may result if someone has an abnormal cervical biopsy or an abnormal smear? Well, if you've had an abnormal colposcopy or abnormal cervical biopsy as a result of an abnormal smear, your treatment options will depend on your age, your fertility status, if you have any symptoms, and what your personal wishes and wants are. In someone young who needs to complete their family and have not had children or have not completed their family, a little bit more conservative treatment option is followed. This includes treatment like the loop excision of transformation zone. This is a slightly smaller treatment where the abnormal area of the cervix is scooped out. This is done under a short anesthetic as a day case procedure and certainly allows the person to be able to pursue their fertility options in future because this is a more conservative treatment option. In women who have completed their family and have no desire for future fertility, they may opt for a slightly more definitive treatment option like a hysterectomy. This is as far as possible done by minimally invasive options, either laparoscopically or vaginally, to enable complete removal of the cervix, which means the risk of the cervical cancer is certainly mitigated and further surveillance is performed, and if that is normal, then no further cervical screening may be required. What are the implications of an abnormal pap smear if someone is pregnant? So the pregnancy does not change the natural course of the human papillomavirus or cervical cancer disease. A colposcopy as a procedure is very safe during pregnancy. However, generally we avoid taking cervical biopsies as they are a little bit more invasive, and we expect that in pregnancy, when blood supply is a lot more in the developing pregnancy and the uterus, that there might be a lot more bleeding. So usually, unless there is very high suspicion of cancer, cervical biopsies are reserved for after the pregnancy has been delivered in the postpartum period. So women are often followed up with repeat colposcopies, and once they deliver, as early as 4 to 6 weeks after their delivery in the postpartum period, we see them back again and a repeat colposcopy, and if required, a cervical biopsy is performed at that point. I often get asked this question, Dr. Sachin, can I do anything to prevent an abnormal pap smear? Well, you can't do anything to prevent HPV or any abnormality that the HPV might cause, but it is really important to have regular cervical screenings to be able to detect very early changes. Through these, we can treat those and cure any changes that the HPV might have caused. It's also really important to maintain a good immune system, a healthy lifestyle, a good diet, good sleep, exercise, and reduction in any situations or habits that can adversely affect your immune system, like giving up smoking, is really recommended. What you're essentially doing is you are halting the progression of the HPV associated changes from very early changes to high-grade precancer to cervical cancer. These changes are hastened when someone has a low immunity. So having a good immunity and looking after your body, having regular smears, following up with your general practitioner and gynecologist is the best thing you can do to protect yourself against cervical cancer. If you have any further questions, please do not hesitate to go to www.lotusmedics.com.au. I hope you've really enjoyed and benefited from the information from this video. Thank you.